learning to take it in our stride, the price we're paying to keep elements of our lives from happier times. Once unimaginable rules, restrictions and curbs on everyday life. Soon, almost all the legal restrictions imposed by the state during the pandemic will be lifted in England. Use your judgment, the government will say, as it implores us to learn to live with a virus, hopefully blunted by vaccines.
There's only one reason why we can contemplate going ahead to step 4 in circumstances where we'd normally be locking down further, and that's because of the continuing effectiveness of the vaccine rollout.
All going well, and from the 19th of July in England there will be no limits on social contact, no requirement to wear face coverings, but guidance on where and how they can reduce the spread of the virus, no limits on attendance at weddings and funerals, ending of the working from home message, the lifting of the table-only service rule and no QR codes for indoor venues, and opening of all businesses, including nightclubs. All of that possible after evidence that the vaccines have weakened the link between infections, hospitalisations and deaths. The latest data show a dramatic rise in infections at a rate not unlike previous waves, an increase in hospitalisations, though at a mercifully slower rate than the wave in January, and finally on deaths, rising but at a fraction of earlier waves.
We must be honest with ourselves that if we can't reopen our society in the next few weeks, when we will be helped by the arrival of summer and by the school holidays, then we must ask ourselves, when will we be able to return to normal? And to those who say we should delay again, the alternative to that is to open up in winter, when the virus will have an advantage, or not at all this year.
And a blunt warning from government scientists of a difficult winter ahead.
So the winter is inevitably going to be tricky, and this winter the NHS is likely to have both COVID and some resurgence of other respiratory viruses that were suppressed by the degree of lockdown last time round. So I think we should be realistic. This coming winter may be very difficult for the NHS, and I don't think that's a particularly controversial statement.
As a celebrated libertarian, Boris Johnson has long dreamt of the moment when he would be able to look the people in the eye and say, I am ending the overbearing COVID restrictions. This is, after all, the Prime Minister who had hoped to send the virus packing a year ago. But there was no triumphalism today, only caution, as Boris Johnson served notice that this pandemic is far from over. A welcome from one Tory MP.
There is a general consensus across the party now and on the backbenches that, if we can't get these measures removed in summer and learn to live with this virus, now that we know that the vaccines are extremely effective in breaking that link between cases and deaths, if we can't do that in the summer, then when are we possibly going to be able to do that? Because in winter, we know there will be a return of respiratory illnesses, including, we presume, COVID. So I think most colleagues are now in the position where, as long as the data supports it, which it does at the moment, we have to get these measures off and get back to some degree of normality.
Can I ask you, we've had the Prime Minister all too much, too soon, according to Labour.
I think it does look like a Big Bang opening. Of course, this time we've got vaccination. That's a tool in our locker that we didn't have last time. But the government, Sajid Javid, Boris Johnson, they cannot be a one-club golfer. We're not going to get through this at this stage of the pandemic just with vaccination, because only around 50% of the English population has been vaccinated. So we need to pay people decent sick pay to isolate. We need to ventilate buildings. And if mask wearing protects others, if it protects you as well as protects me, why are we telling people that they don't need to wear a mask on public transport? I think that's the height of irresponsibility.
Reasons to be cheerful, but in some quarters unease at the pace of unlocking in the face of a virus that isn't finished with us yet.
That was Nick Watt there. Well, in a moment we'll speak to the Conservative MP Laura Farris and to the former Labour Health Minister Ben Bradshaw on this. But first we're joined by Dr Natalie McDermott, an infectious disease expert from King's College London. Dr McDermott, are we OK on masks? You heard Chris Whitty spell out the 3 instances he'd wear one. I guess if we all stick to the Whitty laws, we're fine, aren't we?
Well, if we all stick to them, yes. And I think that that's the big question. I mean, my experience of taking public transport recently is, even with it being a law, there's a substantial number of people choosing not to wear them or not to wear them properly. And, you know, I think if our experience said that people will always act in the interests of others, then it's fine to make that decision. But I think the fact that we felt the need to make it a law about 15 months ago or so, and the fact that even with it being a law, not everyone abides by it, suggests to us that possibly people won't be continuing to wear it. And it also sends the wrong message to them. It says, actually, hey guys, you don't need to wear them anymore, but we'll leave it to your judgment now, even though we've set the law for the last 15 months or so.
So how would you respond to that statement, if not now, when? If we're going to get a return of respiratory illnesses, why wouldn't we do it in the summer?
Well, I appreciate that the summer is an opportune time to do it, but it's very unusual to basically unlock a situation and resort to having no measures in place to prevent the escalation of an infectious disease epidemic or pandemic at a time when you've got increasing numbers of cases in the country. And yes, we have the vaccination now, which has fortunately reduced the number of people dying from this horrible illness. But I think that we need to remember that death is not the only negative outcome from being infected with COVID. And actually, there will be a lot of people who go on to develop other illnesses because of COVID. So we know that there's a rise in diabetes in people who've had COVID who weren't previously diagnosed before. We know that there's a rise in thyroid conditions. And we also know that there's long COVID, and we need to factor that in. There's a significant proportion of our young to middle-aged adult population who will be struck down by this virus and struggle to fully recover.
I guess the flip side of that is, all the illnesses that we haven't been given as much emphasis to over the last 16 months, and the balance of risks that we all now understand very well. What do you expect will happen over the coming weeks? I mean, do you see this as a temporary reprieve and not an end?
A temporary reprieve in the sense of the restrictions being removed.
Right.
Well, I think that, if we give the virus a foothold now by removing restrictions, we're probably just setting ourselves up for a bigger problem in the autumn. The last thing we want to do is allow a virus to gain a foothold and circulate significantly within our population as we come into the winter months. We saw what happened last summer when case numbers were vastly lower than now. I mean, today's numbers were in excess of 27,000 new cases. They were vastly lower this time last year. And yet, what with summer travel and everything, we saw a significant rise in the autumn. We should be waiting until all of our adult population and possibly some of our younger adult population or children and young people are immunised, fully immunised, before we reduce our restrictions, or we are going to see a significant rise in cases, which is then going to trundle on into the winter alongside other respiratory viral infections. And just coming back to you on the were we spared problems from other respiratory viruses? Actually, what we do know now from COVID is it causes significantly more problems after infection with COVID than after other illnesses. If we had a number of people having ongoing long-term problems following illness with influenza, we would be immunising our entire adult population, not just those over 65.
Natalie
So
McDermott,
we need to be thinking about that.
Thank you very much. Thanks for being with us this evening.